Hello and welcome. Today, we're exploring a condition that can turn fingertips and toes a ghostly white or a striking blue, Raynaud's phenomenon. While not a primary heart disease itself, it can sometimes be linked to underlying heart conditions, making it important to understand. So, what causes Raynaud's? Essentially, it's an exaggerated response to cold or stress. There are two main types, primary and secondary. Primary Raynaud's has no known underlying cause. Secondary Raynaud's, however, is often associated with autoimmune diseases like scleroderma, lupus, or rheumatoid arthritis. Certain medications, smoking, and repetitive actions can also contribute to secondary Raynaud's. Now, let's delve into the pathophysiology. When exposed to cold or stress, blood vessels, particularly small arteries in the fingers and toes, constrict excessively. This vasospasm dramatically reduces blood flow to the affected areas. This lack of oxygen leads to the characteristic color changes, first white as the blood drains, then blue as oxygen is depleted, and finally red as blood flow returns. Prolonged or severe vasospasm can even damage the tissues. Raynaud's phenomenon is surprisingly common. Primary Raynaud's affects an estimated 3 to 5% of the population, with women being more frequently affected than men. Secondary Raynaud's prevalence varies depending on the underlying condition, but can affect a significant portion of individuals with autoimmune diseases. The most recognizable signs of Raynaud's are the dramatic color changes in the fingers and toes. These changes typically occur in response to cold temperatures or emotional stress. Affected areas turn white, then blue, and finally red as blood flow returns. This can be accompanied by numbness, tingling, throbbing, or pain. In severe cases, ulcers or gangrene can develop. Diagnosing Raynaud's involves a physical examination and a detailed medical history. A cold stimulation test, where the hands are exposed to cold water, can help trigger an attack and confirm the diagnosis. Nailfold capillaroscopy, a microscopic examination of the small blood vessels at the base of the fingernail, can help distinguish between primary and secondary Raynaud's. Blood tests may also be ordered to screen for underlying autoimmune diseases. As mentioned earlier, we primarily differentiate between primary and secondary Raynaud's. Primary Raynaud's, also known as Raynaud's disease, occurs on its own without any associated medical condition. Secondary Raynaud's, or Raynaud's syndrome, is caused by an underlying disease or factor, such as scleroderma, lupus, or certain medications. Recognizing the type is crucial for effective management. Treatment for Raynaud's focuses on reducing the frequency and severity of attacks. Lifestyle modifications, such as avoiding cold temperatures, wearing gloves and warm socks, and managing stress, are essential. Medications, like calcium channel blockers, can help relax blood vessels and improve blood flow. In severe cases, surgery to cut the nerves that control blood vessel constriction may be considered. For secondary Raynaud's, treating the underlying condition is also crucial. Preventing Raynaud's attacks often involves simple lifestyle changes. Avoid exposure to cold temperatures, especially in the hands and feet. Wear gloves and warm socks, even indoors if necessary. Manage stress through relaxation techniques like yoga or meditation. Quit smoking, as nicotine constricts blood vessels. Avoid medications that can trigger vasospasm if possible. And most importantly, if you suspect you have Raynaud's, see a doctor for diagnosis and treatment. The prognosis for Raynaud's phenomenon is generally good, especially for primary Raynaud's. Most people can manage their symptoms with lifestyle changes and medication. Secondary Raynaud's prognosis depends on the severity and management of the underlying condition. Recent research is focusing on developing more targeted therapies to improve blood flow and prevent tissue damage, including exploring the role of endothelin receptor antagonists and other vasodilating agents. Scientists are also investigating the genetic factors that may predispose individuals to developing Raynaud's.